Many patients come to us with nothing but a simple cholesterol panel or cholesterol screening panel. Docs look at LDL. We look at something different, and here's why.
Bobby Ocampo, my uncle has LDL 81, HDL of 40, triglycerides of 73. Is low HDL a problem if it is below 50? The higher the HDL, usually the better. One of those areas where you're looking at the underlying metabolism and you're thinking maybe it's not the HDL as an actor in this play, maybe HDL is a bystander or a product. If your carb metabolism is not functioning well, both in HDL and LDL, you have what's called a bell curve. You have small particles, you have larger particles. Well, the larger particles in both of these bell curves, the HDL and LDL particles, tend to get chewed up if you have faulty carb metabolism. That happens because the cholesterol that's in those large particles tends to get replaced with fatty acids. Fatty acids in one of these particles, when they pass through the liver, get burned for energy. So again, that's one of those things similar to Dave Feldman and the work that you're quoting and the work that we will cover in a couple of weeks. People don't really understand what's going on with blood particles and cholesterol and lipids very well yet at all. There's a lot of transfer in the bloodstream from one type of particle to another. Again, these are metabolic pools, particles that are responding on an immediate, within seconds, within minutes, clearly within hours, changes of energy needs and energy uses within the body. So is low HDL a problem? It is. Usually it's meaning that somebody's carb metabolism is faulty. Therefore, they're large, fluffy. The more important HDLs are not there because the cholesterol that they carry is being replaced by fatty acids. And when they pass through the liver, they're being burned.
And the other thing that I will add is a basic concept to remember always is that triglycerides are not the result of fat metabolism, are the result of glucose metabolism. So by looking at a panel where they have low triglycerides, if they have low HDL, that's better than having low HDL and high triglycerides, which increases a lot the cardiovascular risk, just because it's the alert that the glucose metabolism is not working properly.
Yeah, as you mentioned that, you're tiptoeing into the thing that I look at first when somebody comes to me and they've got a lipid panel, but they don't have anything else. I don't look at LDL. I look at the triglyceride over HDL ratio. And most folks will say if it's 2 or higher, it's good. I would say, I've seen plenty of people with some significant problems at 2. We do want it, but I've never seen people with significant problems at 1 or less. So the lower you can get, the better. And again, both of those are related to carb metabolism. The latter component that Jesus just brought up is triglycerides. So we forget that insulin does more than just move blood sugar out of the blood and into the cells. It also stops fat burning. Well, that's what triglycerides are.